Bakersfield, California, Dr. Dan Erickson and Dr. Artin Masihi. Dr. Erickson, it's great to see you. Thank you both for being here tonight. A lot of the focus on reopening has been on the economics, but you say that even from a public health perspective, we don't need to be shut in again, especially in California with what we know about the COVID-19 there. Please explain.
Well, I think that what I've been studying over the last 5 days is herd immunity. And I've looked to world leaders, specifically Dr. Johan Giesecke and Dr. Anders Tegnell. These gentlemen are from Sweden. And Sweden, as you know, has taken an approach where people are allowed to move about. Children under 16 are in school, and they haven't done a lockdown. They've done some basic social distancing. And Dr. Giesecke just finished doing a report where he said there's really not a lot of science backing these techniques. So he said we use things like hand washing, a little bit of social distancing because those work. And if you look at their numbers, 200 deaths per million compared to ours, about the same. Italy's 400 per million. And Spain is about 400 per million. So we're looking at this going, okay, they took a completely different approach and their results are basically the same. So how do you get to herd immunity? You do it by the virus spreading throughout the community. Once it hits 70 or 80%, the virus has nowhere else to go and it burns out. So you can do it that way, or you can get a vaccine. But as you know, we have a vaccine for flu. Every year, we watch the flu come in, and it causes about 60,000 deaths. In 2017, about 45 million cases, and we have a vaccine. However, per the CDC website, this vaccine doesn't match the virus very well. And so per their website, as I was reading today, it has little or no effect. So I think the key is a vaccine helps you get to herd immunity, but it also, you can get to herd immunity without a vaccine.
Yeah, well, we don't know. Yeah, what I asked Dr. Fauci a couple weeks ago was, well, how do we know we're going to have a vaccine? We never had a vaccine for SARS. It got close, but then it burned out. And then, the vaccine for the flu is about 55%, 50 to 55% shows effectiveness. I think it does have some effectiveness. Can't say it doesn't have any effectiveness. I don't think that's correct. However, Dr. Masihi, now everybody's holding out New Zealand. Look at New Zealand. New Zealand basically did a really strict lockdown, and they've essentially declared the virus defeated. They basically contained the virus. So now everybody's thinking America can, I guess, go to New Zealand and everyone go back to their homes and don't go to the beaches in California.
Well, first and foremost, thank you for having us. I think one thing worth noting is that we think President Trump did a really good job stopping travel from China as early as he did. And we also think the Newsom administration is doing a great job with what they've done in California to stop the progression and increase in numbers of disease since April 9th. As you know, there's been a downslope of disease. I think the problem with social isolation is how do you get out of it? I think when the virus originally appeared, there was a lot of fear. This is a new virus. It's a mutated version of a coronavirus, and it was deadly. It was killing people, and we were scared. And I think Dr. Fauci was brilliant in instituting these social isolation measures.
Well, when you talk, Dr. Erickson, I'm going to get to you. I appreciate that. The executive director of the Committee to Protect Medicare, Dr. Rob Davidson, he has been tweeting up a storm about your videos and has an issue with your analysis. He said, considering that 109,000 COVID-19 patients have recovered and 55,000 died out of nearly 1 million cases, how can they extrapolate to larger population without knowing the outcomes of the other 835,000? Their statistical method, simple division and multiplication, doesn't quite cut it. How do you respond,
Sure.
Dr. Erickson?
Let's look at Stanford's data. I go to the Stanford study and I say they were predicting, the health department in Santa Clara County predicted 956 positive cases. That's what they had reported. Well, when Stanford did antibody testing out of 3,300 randomized people, they found 2.5 to 4.16% of the population was indeed positive. That means 45 to 80,000 people were positive with COVID, which is 50 times what was reported in their public health department. So and my data is that I just did 6,000 swabs. I had 413 positives, which was 7% of Kern County. My initial data was not randomized. My second data in the last 3 weeks is randomized. So what we're seeing is between 4 and 7% of 2 different counties, Santa Clara County, 2 million, Kern County, 1 million. Each of our prospective data showed 4 to 7%. If you extrapolate that out to different counties in California, you're going to have a couple million cases and 1,700 deaths. I realize that Kern County is different than LA. And that's why when we're talking about opening up America, our approach would be to take Kern County, get the school systems going, and see how the disease progresses. Move slowly, open up the restaurants, see how it progresses. Kind of a stepwise approach down the ladder to get us back to open up the country.
Well, Dr.